Have you ever wondered why your journey to conception might be taking longer than you anticipated? We often attribute fertility issues to various factors, but rarely do we consider the possible effects of specific substances on sperm count. One such substance is testosterone cypionate, a medication commonly used by men worldwide. Testosterone cypionate is a synthetic version of the naturally produced testosterone hormone. It's frequently used for its numerous benefits, such as improving muscle mass, bone density, and even mood. However, while it might be beneficial in many ways, its impact on the male reproductive system can be counterproductive when it comes to conception. Now you may be asking, how exactly does this impact sperm count? Well, the human body is a finely tuned machine, and when it detects an excess of testosterone, it reacts by slowing down its natural production. This also affects the production of sperm, since the process is closely tied to the body's natural testosterone levels. Essentially, the use of testosterone cypionate can trick the body into producing less sperm. This phenomenon is not just a theory, but has been substantiated by numerous scientific studies. Research indicates that high levels of external testosterone can lead to a significant reduction in sperm count, with some cases even leading to temporary sterility. That's right, temporary sterility. Now, this doesn't mean that every man using testosterone cypionate will experience this, as individual reactions can vary, but it does suggest that the use of this substance could potentially be a contributing factor to fertility issues. In the grand scheme of things, understanding this is crucial, especially when you're on the path to starting a family. It's important to be aware of the various factors that could potentially affect your chances of conceiving. In the next few minutes, we will delve deeper into the science behind this and how it might be affecting your chances of conceiving. So, stay tuned as we unravel the complexities of this subject and explore possible alternatives that could mitigate these effects. So, what exactly is testosterone cypionate and how does it affect sperm count? Testosterone, as many of you may already know, is the primary male sex hormone responsible for the development of male reproductive tissues and secondary sexual characteristics. It's also crucial for maintaining fertility. In the testes, testosterone stimulates the production of sperm, thus playing a key role in male fertility. But what happens when we introduce testosterone cypionate into the equation? Testosterone cypionate is a synthetic version of testosterone. It's often used in testosterone replacement therapy to treat conditions in men that result from a lack of natural testosterone. Now you might be thinking more testosterone equals more sperm, right? Well, not exactly. Here's where the science gets a bit tricky. When testosterone cypionate enters the body, it indeed increases testosterone levels. However, this influx of testosterone can trick the body into thinking it has enough of the hormone, causing a chain reaction in the complex hormonal system. The brain, which usually signals the testes to produce more testosterone, stops sending these signals. As a result, the testes can slow down or even stop producing sperm. This can lead to a significant drop in sperm count, impacting fertility. Moreover, testosterone cypionate can also suppress follicle-stimulating hormone, FSH, and luteinizing hormone, LH. These hormones are essential for sperm production and the natural production of testosterone. So, while testosterone cypionate may address low testosterone levels, it could inadvertently create a new problem by lowering sperm count. It's important to note that everyone's body responds differently to hormones. Some men might experience a significant decrease in sperm count, while others might not see much change at all. But don't worry, there are alternatives to testosterone cypionate that might not have the same impact on sperm count. Stay tuned as we delve into these alternatives in the next section. Now that we understand the issue, what can be done about it? Let's delve into some alternatives to testosterone cypionate. One such alternative is human chorionic gonadotropin, or HCG injections for short. HCG is a hormone that stimulates the testes to produce more testosterone naturally. This makes it a great option for men who are trying to maintain their testosterone levels without negatively impacting their sperm count. But how does HCG work? Well, it mimics a hormone called luteinizing hormone, which normally tells the testes to produce testosterone. By mimicking this hormone, HCG encourages natural testosterone production while preserving sperm production. It's like having your cake and eating it too. However, HCG isn't the only alternative. There's also eclomiphene. This is a non-steroidal fertility medicine that works by stimulating an increase in the amount of hormones that support the growth and release of a mature egg. It's generally used by women to treat certain types of infertility, but recent studies have shown that it can also be effective in men. Eclomiphene works by blocking the negative feedback of estrogen at the pituitary gland, which increases the production of luteinizing hormone and follicle-stimulating hormone. This, in turn, stimulates the testes to produce more testosterone and sperm. It's a bit like turning up the volume on your testosterone and sperm production. The best part about these alternatives is that they don't just maintain testosterone levels, they also preserve, and in some cases even boost sperm count. This means that men can continue to enjoy the benefits of balanced testosterone levels without compromising their fertility. However, it's essential to remember that what works for one person might not work for another. Each individual's body reacts differently to different treatments. Therefore, it's crucial to consult with a healthcare provider before making any changes to your treatment plan. In the end, the goal is to find a balance that works for you, preserving both your testosterone levels and your fertility. It's a delicate balancing act, but with the right guidance and information, it's one that can be achieved. Remember, it's always important to discuss these alternatives with a healthcare provider. You might be wondering, how does all this affect me as a woman trying to conceive? Well, we've discussed the science behind testosterone cypionate and its potential effects on male fertility, but this isn't just an issue for men. It impacts you as a partner in profound ways, and it's important to understand how. Firstly, male fertility plays a huge role in conception. If your partner's sperm count is low due to testosterone cypionate use, it could be more challenging to conceive. This could lead to months or even years of trying without success, and each negative pregnancy test can feel like a blow. It's a roller coaster of hope and disappointment that can be emotionally draining. Secondly, dealing with fertility issues can be tough. It's not just about the physical challenges, but the emotional toll it can take on you and your relationship. Feelings of guilt, blame, or inadequacy can creep in, causing stress and tension. It's okay to feel these emotions. They're a natural response to a difficult situation. It's important to remember that it's not your fault, nor your partner's. Fertility is complex, and sometimes things just don't go as planned. Lastly, let's talk about communication. It's crucial to have open, honest conversations with your partner about fertility. Talk about your concerns, your fears, your hopes. Discuss the potential impact of testosterone cypionate and explore alternatives together. It's a journey you're on together, and having each other's support and understanding can make all the difference. In conclusion, the use of testosterone cypionate can have significant effects on conception. But it's not an insurmountable hurdle. With knowledge, communication, and alternative treatments, it's possible to navigate these challenges. It may be a tough journey, but it's one you don't have to walk alone. Remember, you are not alone in this journey. As we wrap up, let's reflect on what we've learned today. We've taken quite the journey, unraveling the intricate relationship between testosterone, specifically testosterone cypionate, and its impact on sperm count. It's not every day we delve into such a topic, but it's crucial to understand the implications it could have on the road to conception. We've learned that testosterone cypionate, a medication often used by men to increase their testosterone levels, can unfortunately have a negative impact on sperm count. While it may be beneficial for those needing a boost in testosterone, it's not so friendly to those little swimmers. In fact, it can lead to a significant reduction in their numbers, which in turn can affect the chances of conception. But it's not all doom and gloom. We've also discovered that there are alternatives available. HCG injections and eclomiphene are two such alternatives that can help maintain or even boost sperm count while also addressing low testosterone levels. These alternatives, while not as widely known or used, could potentially be game changers for those navigating the complex journey of trying to conceive. The takeaway here isn't to induce panic or fear, but to encourage open and honest communication with healthcare providers. These discussions can help you understand the options available and the potential impacts they might have on your journey. It's crucial to remember that every individual, every couple, every journey is unique. What works for one might not work for another. But by understanding the science, the alternatives, and the potential impacts, you can make informed decisions. Knowledge truly is power. By understanding the factors that can affect your journey to conception, you can make decisions that are in your best interest. You're not alone in this journey, and there's a wealth of information and support out there for you. So, as we conclude, let's remember the importance of understanding, communication, and informed decision-making. Remember, knowledge is power. By understanding the factors affecting your journey to conception, you can make informed decisions that are best for you. Thank you for joining us on this journey of understanding the interplay between testosterone, specifically testosterone cypionate, and its impact on sperm count. We hope that you found this information useful and enlightening. Remember, this is your journey, and armed with the right information, you can make the best decisions for you and your partner. As we close, we want to remind you that we're here to provide you with the most relevant, scientifically backed information. If you found this video helpful, please give us a thumbs up. It helps us understand what kind of content you find most valuable. And if you haven't already done so, click the subscribe button and the notification bell so you don't miss out on any future videos. We also invite you to share this video with others who might find it beneficial. Let's spread the knowledge and help each other on our unique journeys. And finally, we're always keen to hear your thoughts, questions, or experiences. Drop a comment below and let's start a conversation. Once again, thank you for watching, and remember, knowledge truly is power. Stay informed, stay strong, and keep going. Until next time.